Okay, so keep in mind the likelihood of experiencing these impacts and the extent are tied directly to your risk level, which you should know from the survey we did in the previous block. If you haven't already, go back and take 5 minutes to complete it. So, how does weed impact the body and your physical health? Well, we know from early on that certain types of weed, like cannabis products with high CBD content, can be a pain suppressant. However, cannabis use can lead to not so good impacts like reproductive issues, making it difficult to conceive or get someone pregnant, and eating issues like binge eating, as well as other problems. Inhaling smoke, for instance, in any form really, can exacerbate things like breathing issues or leave someone predisposed to experiencing lung cancer. Cannabis is also known to increase your blood pressure, meaning if heart or blood pressure problems exist, it can make them much worse over time. It also slows down things like your physical reaction time and endurance for those that might be engaging in athletic activities. When it comes to impacts on the brain, research has shown that cannabis use, especially frequent or chronic use, can impact someone's ability to do things like recall memory, pay attention, and take in and apply new information, which are tied to things like your academic performance and performance at work. While more research is being done on these impacts, it is important to note that we know that cannabis has pretty intense impacts on mental health as a whole. A lot of folks might use cannabis not just recreationally, but to cope with things like depression or mental health disorders. While it can alleviate symptoms in the immediate, research shows that over time, it can make the presence of anxiety or depressive disorders a lot worse. And it can increase your chance of experiencing something like psychosis, even increasing the likelihood of being diagnosed with schizophrenia. While it could help some other folks fall asleep, it drastically impacts the brain's ability to adequately rest and repair during sleep, meaning your overall sleep quality is diminished. Remember, this information isn't geared to scare people away from using cannabis or to make some kind of boogeyman out of substances. It really is just to provide all the context to allow for folks to make informed decisions, weigh risk, and reduce harm as much as possible. We can't make informed decisions if we can't approach a topic with a holistic view. So, in the next section, we'll start to discuss things like harm reduction strategies to reduce the likelihood and severity of some of these impacts if you choose to use cannabis, which again, not all students do. Obviously, though, these impacts are going to leak into other aspects of your life. For instance, as an athlete, cannabis use can impair hand eye coordination and reaction time. It can reduce your maximum exercise capacity, resulting in increased and earlier fatigue. It reduces your motor coordination, your balance, your tracking ability, and your perceptual accuracy. It decreases your strength and endurance over time, and frequent use can cause things like cough and frequent respiratory problems. It also increases your heart rate. When it comes to academic performance, as use continues or increases, students in academia who are using cannabis are more likely to drop out, not graduate at time, etc. That's in part because cannabis use, again, impairs short term memory, it decreases your ability to concentrate, compromises learning skills, has impacts on things like anxiety and sleep, can lead to addiction, and lower overall academic and lifetime achievement.